Welcome to Money, Power, and Medicine. I'm your host, Dr. Jennifer Charles, and today I have a stellar, amazing guest who's a registered nurse in school to be a nurse practitioner, and she's also the owner of Ideal Med Spa. Please welcome to the show, Miss Destiny Dominique.
Hi. Thank you for having me. I'm so excited.
Thank you for coming. So I definitely am so impressed by you. You are extremely young and you have been extremely business minded from a very young age. And that's why I wanted you to come on the show, because I think people think of nursing as like just a linear career, but there's so much that you can do with nursing and being an entrepreneur in nursing. This is something that I think a lot of people are now jumping on board to. So I just wanted you to talk about your experience, how you got into nursing, what made you decide to do a med spa, and what you're doing in the future, because you're definitely someone who I really admire, and that says a lot.
Okay. Yes.
So how did you get into nursing?
So I knew early on what I wanted to do. I started nursing like early. So just knowing what I wanted to do, like as a kid, kept me out of trouble. Like just my environment and everything. Like I was like, just knowing I wanted to be a nurse kept me out of trouble. Like I remember a scenario where I was young and then like we got pulled over and they were like, oh, everybody in this car has a record. And I was like, oh, I'm going to be a nurse. So like they asked me like, oh, like why everybody has a record and you're like, why are you hanging out with them? And I'm like, I'm going to be a nurse.
But why were you?
But that's my environment. Those are my friends.
Okay.
It's like where I grew up at.
Okay.
So, so I'm like, I'm going to be a nurse. Just knowing what I wanted helped me. Like every time my friends were doing something, I was like, I can't do that because I know like to sit for your boards, you can't have a record.
Yeah.
So it kept me like, so I was thankful to know what I wanted early on. And I started my career early. I did PCT, like patient care technician, when I left high school, which is like it helped me get money for school and also work in the hospital setting. So basically, when I worked as a PCT, I was able to get experience on different floors and see where exactly I wanted to be.
What's like the average salary for a patient care technician?
So for example, like CNAs get $12 an hour some places.
Okay.
And depending on experience, it goes up. So for patient care technician, I would say it starts at 16. I was getting 20 because I was in Jersey City area. So it depends on the area you're at, your experience, and like, your education. Being in nursing school helps too because they know like, oh, okay, you're about to be a nurse. So they'll offer you more, yeah.
So is a PCT considered higher than a CNA?
Yeah, so the difference between a CNA and a PCT is that CNAs don't do EKG and phlebotomy. Patient care technician does. So a lot of hospitals would prefer if you had your patient care technician because then they don't have to hire an EKG person. They don't have to hire a phlebotomist. They could just hire one person.
Okay. And how long was PCT school?
So PCT school was 6 months, and I know CNA school is like 1 month.
Oh, really? I thought it was longer. I thought it was like 6 months.
No, it's a month. Patient care technician is 6 because they break it up. You do EKG, you do phlebotomy, and then you do the patient care stuff.
Okay. And phlebotomy is just blood work.
Blood work, yeah. And so, EKG is like the heart.
Exactly. So after you finish high school, you're working you go to PCT school, you're working as a PCT. When do you enter college?
Right after high school. So I did my patient care technician during the summer and entered college.
Okay. And in college, you knew when you entered college that you were going to pursue a nursing career or degree.
Yeah. So knowing that I wanted to be a nurse early, like helped me even in school. So I started at a 4-year program. So that 4-year program, I remember they didn't put me in the classes I needed. So this is important for nurses like that's coming in. If you're in a school that you have to take an entrance exam, you need to know exactly what I need to take to get into this program. So like, for example, my roommate was also a pre-nursing major. She had anatomy 1 and like, so I'm like, how come I don't have that class? I'm also a pre-nursing major. So I went to the advisor and I'm like, hey, I'm not in this class. I want to sit for my T's. I'm a pre-nursing major. He was like, oh, basically a lot of people, like stay here longer because the class was full. And I'm like, but I don't want to be here. Like, I want to take
done.
Yeah.
Cost them money.
Yeah, he was like, oh, no, that's normal. The class was full. But I was like, why nobody was going to tell me? So I went to the teacher for the anatomy class, and I asked him like, "Hey, can you sign me in? I heard you guys could sign students in." And he was like, "We have a test on Friday. So basically, if you could pass this test on Friday, I'll sign you in." So I went to the bookstore, got the book, passed the exam, and he signed me in. So I went back to my advisor like, "Hey, I got into this class. Can you put me in?" He was looking at me like, "How'd she get into this class?" And I was like, "Just put me in."
So you have to fight for what you want.
Yeah.
Essentially.
Exactly. And that's why knowing what you want is important, so you could be structured too. So like I was like, okay, now I'm in anatomy, because you got to take anatomy 1, anatomy 2, then you could sit for that entrance exam.
Okay.
So if I didn't take that, it would have prolonged me an extra year.
Yeah.
Yeah.
So you were done in 4 years?
No. So what happened was I got into even all of that work I did. I passed my entrance exam, but it was a wait list. So I got into the wait list.
Okay.
So they're like, okay, you're scheduled to be in next year. And I'm like, no. So funny story. Somebody reached out to Instagram too. Like, I got into the wait list. What should I do? And I told her, move on. That's what I did. You don't wait a whole year. Like, why would I prolong myself? Okay. So I went to an accelerated program.
So what is this, year 2 for you, or did you?
Yeah.
You year 2 in college. You got waitlisted for the nursing program.
Yeah.
So then you just transferred.
Yes, I went to an accelerated program. So I actually got my bachelor's in 2 years at the accelerated program.
Okay.
Because basically, accelerated program, you're in fall, winter, summer.
That's a lot.
That
no
is.
break.
No break.
Okay. So school all year round.
And they're usually 3 years, so I got it done in 2.
That's amazing. That's what I'm saying. You're an amazing girl.
Thank you.
To do that quickly, it saves you time. Also saves you. Does it save you money?
So because the accelerated program, that particular school is a private school, it was a little bit more. Like my 4-year undergrad, I actually had a scholarship.
Okay.
So I left my scholarship because I was on the wait list.
Okay.
Yeah, and I paid for my nursing program.
Okay.
Yeah.
So did you find the accelerated nursing program to be very difficult?
In the beginning, but once you learn like your technique to study, then it gets easier. Like you have to know what is good for you and how to study. Like that's the first thing I always tell like girls that reach out to me is learn your study method. My study method is basically rewriting stuff.
Really? So okay, that takes you
Yeah.
a long time.
So basically what I do like when I study is make up stuff in my own like words.
Okay.
So once it's understanding to me, then I'll just like keep rewriting what I wrote.
Okay.
And then it's like when I see the exam, it's like, okay, I know this.
Okay.
Yeah.
And this is how you studied during nursing school.
Yeah.
Now let's talk about the NCLEX. Well, let's backtrack. So you can finish. This is for people who have a bachelor's degree and now are considered going to nursing school. Somebody asked me or said recently, like, okay, I have my bachelor's. Do I have to go to nursing school for 4 years?
Oh, no. They have an accelerated program that's 1 year, but you have to have like science-related bachelor's. So like if you have a lot of the prereqs done, so I always tell people if the classes you don't have, like the prereqs, do it during the summer, get into that 1 year bachelor's program. So it's called like accelerated bachelor's program.
Okay.
So it's like a 1 year for the people that have their bachelor's already in science field. Like if you have a psych, sociology, health science, stuff like that, it only takes 1 year with making sure like you already got the prereqs like anatomy 1 and 2 done, and it'll take 1 year to finish a BSN.
Okay. Do you need a bachelor's in nursing? Because I know somebody who got an associate's.
Yeah. So before COVID, a lot of like hospitals wouldn't hire because everybody was going towards the magnet route. COVID changed a lot of things.
Okay.
But before COVID, everybody wanted to become magnet hospital. So for them to become magnet, all their nurses had to be bachelors. So they would hire associates, but they would tell you like, hey, you have 6 months to enroll into the bachelor's program.
Okay.
Yeah, so then you have to be completed within 2 years of working here. So that was before COVID. They wouldn't even hire LPNs. Okay. But now during COVID, things have changed. We need nurses. Okay. They're hiring LPNs back in the hospital, and they're hiring associates. But, we don't know how long that's going to last.
I'm glad you said that, too. LPN. Yeah. What is that?
That is a 12-month licensed practical nurse program. So a lot of people that just want to test out nursing but don't want to stay, I always say, like, do an LPN as a safety net.
Okay.
Yeah, so like you know, if you, like for my sister, for example, she wants to be a director, but she also wants to be a nurse. But I told her, you know, do the LPN. It's only 12 months. Then you could go follow your dreams. At least you have a safety net. Like that job pays from 30 to 60 an hour.
That's good money.
So at least you have a safety net. You only have to work 3 days. Then you could go be a director the rest of the days, you know?
Okay.
At
Like a
least
film director.
A film director.
Okay.
So I always tell girls, like, you know, test out nursing. That way, if to see, like, if you like it, LPN is a good start. Because then there's like an LPN to RN program, RN to BSN program.
What is the LPN to RN program?
It's another year. It's just like a ladder.
Okay, like a gap, like a
Yeah.
bridge.
And it saves you money that way doing a bridge. Like, I wish I did it that way. But because I was like 17, you might as well just get your bachelor's. But I wish I would have did LPN first and then did the bridge. I would have saved money.
Okay.
Yeah.
Okay. So you are in your accelerator program. You're done. Now you have to prepare for the NCLEX.
Yeah.
How was that? Because I know a lot of people who have failed the NCLEX and are scared to retake the NCLEX, or they're really fearful of taking the NCLEX. Can you talk about that a little bit?
So the NCLEX, I would say, like know what you want early. So the NCLEX, you basically, my 3 top things that I tell everybody is make sure you get that ATT number, which is the number that you're going to use to sit for the NCLEX exam. So some people wait long and then get that ATT way longer. And the better, like, to do is basically take this exam as soon as you graduate, because that's when you know everything. If you wait 6 months, you're going to, like, it's going to scare you. So I took my NCLEX 15 days after graduation.
Okay.
So I feel like that's the best way to do it.
What is the ATT?
So ATT is the number that the boards give you, and that's when you use to sit for your boards. So they send you an ATT number, and then you'll use that number to register for seats for the NCLEX.
Okay.
Yeah.
So you took the exam within 15 days. Did you take a prep course? Because there are a lot,
Yeah.
like Kaplan, and what else is there?
Yeah, so I did the ATI review in my school.
Okay.
So I did the ATI review. So everything you learn in nursing school, you're not going to remember all of that. So the review is going to bring your 4-year education into one, like, 2-week course. So that's what, like, you really need a review right before the NCLEX.
Okay.
So that helps. Like, that live review is, like, the best thing you need.
Can you say what it is again? What you took with your
ATI review.
What does that stand for?
It's
Do you know? Okay, I don't know.
I don't know, but like all the nursing people that we know what ATI is, like, it's just a company.
Okay.
So like Pearson,
Kaplan.
Kaplan, it's just a company.
Okay.
ATI.
Pearson, I've heard of Pearson before. Kaplan.
Kaplan. Well, I would say a lot of people don't really like Kaplan. They said it's really hard.
Really? Yeah, studying for the MCATs, Kaplan exam questions were more challenging and more difficult.
They said, like, if you're a person that likes to think outside the box, like that's too hard for you. You want to, like, NCLEX is a perfect world. You don't want to be thinking outside the box.
Okay. I understand what you're saying. So, I'm assuming, or I know, that you took the NCLEX once and you passed. How did you actually study for the NCLEX? What did you do?
So the review, and then the first thing I always tell people is Pearson gives you a template. So the first thing you do is get that template. So, like, for example, my friend just took her LPN boards. That's the first thing I sent her. You go to pearson.com, and then you go to, like, RN or PN, whichever NCLEX you're taking, you get that template. It basically gives you a structure on what's going to be on the exam. So that's where you will start. Like, hey, what's on my exam? That paper will tell you exactly what you need to study to pass your boards.
So what are the different specialties in the
They have, like, peds, they have maternity, they have med calc, they have psych, but everybody's NCLEX is going to look different. So your friend could say they had med questions, and peds, you might not have peds or med questions. So every exam is different. And every 2 years they change it. Now they're doing, like, scenarios, and, like, they're putting sounds in there. So they're like
heartbeats?
Yeah, heartbeats. Yeah, they're doing, like, they're trying new stuff. Yeah. Then it's called the new generation NCLEX.
Is it more challenging? I wonder if more people
I don't think it's more challenging. I actually think because a lot of people study differently. Some people like mnemonics, so that helps them. Like, seeing pictures help. So I don't think it's, like, more challenging. I think some people actually needed that than a whole bunch of questions. Some people like pictures.
Okay.
Some people like, oh yeah, I heard that sound before. Some, like, I like how now it's, like, going towards, like, the different way people study.
Like a diverse
Yeah.
exam.
Because some people don't like to just see words.
Yeah.
Like, when you see pictures, it kind of calm you down. And then my third thing for studying for the NCLEX is know your weakness. So after you get your ATT number, be on top of that. Then you basically get the structure for the NCLEX. And then your third thing is know your weakness and practice your weakness. So my weakness in my nursing program was select all that apply. Select all that apply is very scary because it could be one, it could be two, it could be all three. You don't know. So that one like really scares people. So what I did during my NCLEX review was all I did was select all that apply. I trained my body to do select all that apply.
Yeah.
So when I saw the select all, because when you see select all that apply in the NCLEX, that means you're doing good. Mm-hmm. So I had to train my body to not get scared when I see it.
I love that you're saying that.
Yeah.
Because I feel like what you're saying kind of applies to life. If you really want something but you're fearful.
Yeah, you have to go attack it.
Exactly.
Yeah. So I was doing select auto applies like, hey girl, hey. like so when I saw it, I was happy like, I see a select all because I know I'm passing. Yeah. When you see the select all, that means you're passing, especially when you get it back to back.
Okay.
When you see select all back to back, that means, okay, girl, you got this. Mm-hmm. They're throwing you this because you've been passing. Okay. So when you see it back to back, that means you're doing good. So I had to unscare myself so I could see it back to back.
I love that you said that.
Yeah.
Okay. All right. So now we're going to move. You got your nursing degree. Mm-hmm. You are that's a board certified nurse. Mm-hmm. So now you get your first job. Right? Mm-hmm. Where did you decide to work? Not where specifically, but you decide to work at a hospital or a nursing home. Some people say going to a nursing home is easier. I've heard that.
So the thing is, once you have your bachelor's, you don't want to go towards the nursing home because the nursing home is mostly for LPNs, the licensed practical nurses. That's who they hired there. And once you retire, a lot of people go towards the nursing home. But as a bachelor's graduate, you want to go towards the hospital because that's where they want you. Mm-hmm. So I went towards the hospital. I noticed from, like I said, patient care tech, it helped me work at the hospital and see where I wanted to go. So I was like in ICU. I was like floating around emergency room, and I saw I love trauma. So trauma is like my thing. That's my best friend.
I love excitement.
I love excitement. I love trauma. I like accidents. I love blood. I started like in CV ICUs, which is like ICU for the heart. Mm-hmm. So like we did a lot of open heart surgery. So that helped. Like sometimes they'll bring a patient out with their whole chest open, and I'll be looking like you're
just really interested.
Yeah. So that's my thing. I love like intensive care.
Yeah, I can tell you're really science inclined. Mm-hmm. We'll talk about what you did for me one weekend. So you ended up in the hospital. I think at one point you wanted to become a CRNA.
Yeah, I did. In the beginning, but doing research, you need like a lot of support system for that. So that's why I started ICU because. Mm-hmm. To become a CRNA, you need ICU experience. So just know like what you want to do with your nursing career years later. You have to set up your whole nursing career like that. Mm-hmm. So I did telemetry, which is like the heart because I was good at it doing EKGs. And then, also did ICU. So I always kept like 2 jobs. Okay. So with CRNA, I could have got in because I was an ICU nurse.
You need 1 year.
Yeah, you need 1 year, and you need to get your like critical care certification. That's another like board certified exam.
I didn't know.
Like certification, to get into the CRNA school.
Okay. Mm-hmm. So then you change your mind.
Yeah, I mean, I feel like I'm gonna do it later, but I decided to change my mind because everybody was saying like you need support, like you need to not work for like the whole
3
time.
years.
Yeah, the whole 3 years. Mm-hmm. And I was looking like, okay, I don't have family like that to go. Like I took care of myself since a kid. I paid my rent since a kid. During nursing school, I paid my rent, my car, everything I needed. So I knew I could not take a step back and let somebody take care of me because I don't have that. So I knew like, okay, I don't have like a backup plan like to go home to do school,
That's why I admire you.
Yeah, I had to like take care of me, so I knew I couldn't do that. So I did nurse practitioner because I have a med spa, and I know that will help me with my med spa.
Let's talk about that. So you started your med spa how long ago?
2020.
2020. Okay.
Yeah. So like right when I graduated.
Okay. Mm-hmm. So what made you want to do the med spa?
So I always wanted to do aesthetics. I'm a girly girl.
I know.
So I love aesthetics, like just the look. I love so as a nurse, you like to make people happy. So aesthetics is the same thing. Girls come in and they feel like insecure about something and you fix that. Mm-hmm. So like when I do lips and the girls start screaming like my lips look so good, I love that feeling. So I So I started doing teeth whitening just to get my name out there and see what I needed to do to become an aesthetic nurse.
Okay.
So that's like a class you have to take after like a year of nursing experience.
So yeah, break that down. So how did you become a nurse injector? Did you take a course?
Yeah, so there's a course.
Mhm.
So some courses are 2 days long and some courses are 1 day long. It just depends on what you find.
Okay.
So there's
And you did
different courses. I did a 1 day course.
Okay.
And then I kept practicing. Like my family's like really like supportive, so they all let me practice on them so I could get comfortable.
They just wanted free Botox and free lip fillers.
That's fine with me. I got the practice. I got the practice, and I was like, "Hey, girl, can I do your lips? Hey, girl, can I do your Botox? Hey, girl."
Yeah.
Like, you know, and even like they have a gay best friend, so he was like, "Yeah, do me, do me." I was like, "Come here."
So it's a 1 day course, and this course is a little expensive.
Yeah, it starts at $3,000 and it could go up to like $7,000.
Oh my goodness.
Yeah.
The $7,000 should be like a week course or something.
Exactly,
And
but they just like to make their money. Yeah.
We'll talk about that.
Mm-hmm.
Money, power, and medicine.
Yeah.
Okay, so you finish the aesthetic course, and then you're like, I'm going to do a med spa.
Yeah. So I started, like I said, doing teeth whitening to get my name out there. So I was like, okay, how can I become an aesthetic nurse? So that's one, take a course.
Mm-hmm.
And then you need a medical director. So I'm in the state of New Jersey. The state of New Jersey does not allow nurses to practice on their own. You need a medical director and a nurse practitioner over you, seeing your patients, and then you could administer Botox and lip fillers. So you have to check your state requirements for what you do. There's a lot of states that you don't need a nurse practitioner. You just need an MD. So, or if you become a nurse practitioner, you're good by yourself. You don't need an MD. So you just have to check your state's requirements. So that's the second thing. Of course, check your state requirements and get the right like licensing and permits to do it.
Mm-hmm. So then you found a space.
Yeah, it was like a medical building. So I had like a suite in the medical building.
But the thing about you that I really admire is that you're not there full time, but you created a business model for yourself that still is able to pay that overhead expense. Do you want to talk about that, or you want them to keep that a secret?
So like you could so I rent out space to other girls.
Smart.
Yeah, so like other girls,
don't play with her.
Other girls like other girls do lashes and like other stuff. I keep like the nails out because of the smell and because, you know, when you're doing IV therapy, you don't want to smell nails. But like, you know, I let lash girls, different type of like body contouring girls rent out space in my suite.
Smart.
So even when I'm not there, there's overhead just because I need like, you know, to keep getting my experience as a nurse.
Correct.
While I'm in nursing school again.
Correct. You also offer IV therapy. Do you want to talk about that now? So you did this for me the other day, and I thought it was great. I do not drink enough water, and where we're at right now, I'm not going to put them on blast. Did not give me any water.
Yes, I know.
They normally have water. They normally do a good job. But you gave me, I think, 500 mLs. And what else did you give me?
I gave you glutathione, vitamin C, and some immunity drip, too.
In my home, it was a great experience. Glutathione has aging benefits.
Yeah.
Vitamin
and
C.
help your skin glow.
Exactly. Vitamin C helps with the immune system. I don't take daily vitamins. I'm always on the go. So for me, I thought it was a nice additional treatment to get done at home.
Yeah. And then people that take like vitamins daily, like one IV infusion is like 1 month worth of those pills.
Yeah.
So it just like goes right into your bloodstream and helps like your body.
I agree. And you also gave one to my cousin.
Yeah.
But you offer this as a service.
Yeah.
And this is a business that's becoming, I think, really popular. Mobile IV hydration.
Yeah. I like to be in my space, but I do like to offer mobile, especially around the winter time. Because people like, you know, come from work. Some people work night shift. Some people work day shift. So just have like that convenience of somebody coming to you is like a luxury too.
And they could be hungover.
And we have a hungover drip for like the girls that like to go out or the men that like to go out and then they drink excessively. We have a hungover drip.
And you offer Zofran.
Yeah.
Which is a
if they're
medication.
feeling nauseous or anything, we're always like making sure if you have allergies, we have Benadryl. So it's like we have like a lot of stuff. I even like for the workout people, there's a workout drip. It helps give you energy because sometimes you're like feeling fatigued and tired. And like the workout drip will give you energy and also help with like your muscles.
I love that you're doing that. Okay. And we're going to bring this back a little bit because you're also in nursing school right now.
Yeah,
Can you talk about why you decided to become an NP?
Yeah. So like I said about the state of New Jersey, you need a medical director and a nurse practitioner. So why not get rid of the nurse practitioner if it's only like 2 years of school? Yeah.
I love how you say it's only 2 years of school. Some people are
the
like,
2 years are going to
much.
come. The 2 years came anyway. I graduated in May. The 2 years are going to come. So if I didn't do it, the 2 years is still coming. The 2 years is coming. Exactly.
Not just, but you would have just been an RN.
Exactly.
And now you're going to be an NP.
The 2 years is going to come regardless of what you want to do, don't want to do. That, like, people are like, oh my gosh, it's going to take me 6 years to become a doctor. Those 6 years are still coming.
Yeah.
So that 6th year that you could have been started, you're going to be looking back, it's 4 for med, but then you do residency. So I count that. It's like 8 total.
Yeah.
Yeah. So like
8.
Yeah, 8 total, right? Okay. So like it's still gonna happen regardless. So like say that 8th year when you could have been started, you're gonna look back like, damn, I could have been a doctor today. You know? So
I'm glad you said that because time
don't wait
shouldn't be a limiting factor if you have a dream for yourself.
Exactly.
And you want to achieve something for yourself. Not saying that you have to be a nurse or have to be a doctor. This is with anything, whether it's with tech now, which is becoming extremely popular.
Yeah.
No matter what it is, don't look at like time as being a limiting factor for you because like you said, time is going to pass by regardless of what you're doing. So why not put yourself in a position to put yourself ahead in life?
Exactly.
I love that you said that. So you also do you offer a lot on your website. Can you say your website that we're going to put below?
Yeah, so it's www.nursemalibudestiny with 2 Ys.com. And my Instagram is 2_ Nurse Malibu Destiny with 2 Ys_.
And what courses do you offer?
So I offer a lot, like IV therapy courses to nurses. I offer like Botox and lip filler courses. I offer I even have an ebook. If you need a medical director, you could check out my website and it'll give you like a list of how to get a medical director for your space if you want to start your business.
You do a lot.
Yeah,
I'm so proud of you.
I have a new ebook for nurses because I feel like when you become a nurse, you don't know where to start. Like this girl, she hit me up after reading my ebook. She was like, I was ordering like Stanley cups and stuff, not thinking like all the stuff that I need went for my first day of work. And like just, to better prepare nurses for your first day. Because my first day, I was looking stuff up like, what should I bring with me? So it's like I put it all out for you and just get you comfortable.
How much is that book?
I change the prices different times. Like it depends. I offer discounts. Like sometimes like $50. So it depends on when you catch it. So I don't want to give like a main price because it depends on when you catch it.
Maybe I have to do like a subscription and then you could get a discount to her
ebook.
Exactly. We're gonna see by the time this episode comes out.
And I also have an ebook, like if you just want to start like a scrub business. So I have I listed a whole bunch of vendor lists.
Yes.
Yeah. So they could also look into that. And it teaches how to form an LLC, what do you need and stuff like that.
Because you have an LLC for your med spa. Okay. Yeah. And what is the future for your med spa?
So the future is I love the whole cloud med spa idea because a lot of med spas, they don't let new nurses come and work. They want you to be advanced and nurse practitioners. So my cloud med spa basically allows training for new nurses that want to get into aesthetics because a lot of nurses get discouraged. They won't hire me. So cloud med spa allows me to train new nurses, become aesthetic nurses, and then they get to work in my space. Rent out space, and then they get the help, they get support, they get training there, they get the products that they need, and just it feels like a team. They're always happy in my group chat. Yeah.
I just thought of something. Medical malpractice. Do you have that separate for your med spa?
Yeah, so there's a business malpractice one, and then there's one for your medical director. So I have 2. So one that covers the medical director, just because, anything can happen, and then one that covers your business.
Okay. Would this do nurses, if they come into your space, have to get their own malpractice?
They have to get their own business malpractice, but the medical director malpractice, it gets covered by everybody.
Okay.
Yeah, so that's part of their membership.
Okay. The next thing that I want to talk about is your medical mission trip.
Oh, okay.
And because I know you have an ebook on that as well.
Yeah. Guys, that's actually a free ebook.
Okay.
Yeah, because it's a mission trip. You don't want to charge for that. I just want to give you guys help, how to find mission trips and stuff.
The fact that you were able to have an idea, actually do something for humanity, right?
Yeah.
Because when you're doing medical mission trips, you don't get paid for this. You are using your own time
Yeah.
and your own energy in order to help other people. And the fact that you were able to bundle this up into a book to help other people, just speaks volumes about the type of person you are, the character that you have. Okay.
Yeah.
You're my baby. So can you talk about your trip?
Yeah. So, okay. So a mission trip was really good for me because since I was a kid, the main reason why I wanted to become a nurse is because my parents are from Haiti. My family's from Haiti. Haiti's a third world country.
We are.
So we don't have a lot of medication. We don't have a lot of stuff that we need. So like Red Cross, for example, goes out there and help out sometimes. So I used to always look at that like, oh my gosh, I want to be a nurse for third world countries. So a mission trip is basically that, where you take time out of your busy schedule to go help a third world country. So there's different type of mission trips. There's like clinical mission trip and there's surgical. So I did a surgical one. So we went to Ghana for 10 days and we did 100 free surgeries.
That's amazing.
Yeah.
How many hours were you working?
Oh my gosh.
You worked hard?
I worked hard. Not gonna lie. I worked hard. So I was a PACU nurse, which is like post-op. So after the patients got surgery, they came to me. So I was the only PACU nurse.
Oh my goodness.
Exactly. But they helped, they sent like 2 locals to help me every time I was there. Like, so I would just tell them what I need and they'll just be my support, help me with vitals. So the good thing is I have experience as a PACU nurse, so I was able to see like any type of signs. If something was wrong, I would send them back to the OR.
You told me about one specific case where a patient.
So she got she had a complication. She got basically a hysterectomy, which is like they removed the female uterus. So she had like big fibroids. So that sometimes looked like you're pregnant. Like she looked at like 6 months pregnant. So like I was just saying like, oh my gosh, like the doctor did so good. She was a female. The surgeon did so good. She basically looked like she got a tummy tuck. I was like, I'm next, joking. So that's how I knew that was the first sign. So when she was like after surgery with me, her stomach started looking distended and she wasn't really responding. So in Ghana, how they get blood is not like here. Your family has to travel from wherever to come donate blood to you. So her family
in Haiti.
Yeah. So luckily her sister was downstairs, so we was able to get her blood to replace everything that she lost during surgery.
So she was bleeding out.
So she was feeling distended. She wasn't, and usually when you get blood, you start responding. Like you start looking a little better too. So she wasn't really responding, and she was like looking very distended. So I was like, something is off. So I was checking her vitals. Her blood pressure was low. I was like asking the doctor, can we give her fluid? Usually if the blood pressure is low, you want to push fluids. That wasn't working. So I'm like, her stomach don't look good because I was just saying she got a tummy tuck, So, like we're doing, like I'm listening to bowel sounds, like feeling around. And then once I started feeling around, because you have to listen first before you start touching. So I saw like, blood was coming from the dressing. Too much blood wasn't good. They're like, yeah, Destiny's right. Let's send her back.
See?
Yeah. So she basically they ended up removing like 1 liter from her stomach.
That's a big deal.
It's a big deal.
The human body holds about 5 liters. So having 1 liter in your stomach,
she was making blood clots, everything. So basically what happened was when they removed the fibroids, you have to stitch up the veins.
Yeah.
So they probably missed a vein or it probably just popped.
Yeah.
So they was able to find that vein that was bleeding out, stitch it back up, and she was good. Like even like when I got her back and she was responding better, we wasn't able to feed her just in case of another emergency. But yeah, we were there for 10 days and we gave like 100 free surgeries. Some of them was like hysterectomies, some like surgical stuff. Like some girl, like one of the ladies basically had acid thrown on her like 4 years ago, where her neck was like stuck like this for years. So, they don't have a lot of like out here we have Medicare and we don't have a lot of plastic surgeons. So our plastic surgeon was able to like distend her neck, and she was able to like move it again. So she was so happy. Like
she looked good. I saw your Instagram page. It was really good. Like I said, I think you're an amazing person.
Yeah.
Ever since I met you from day one, you're a phenomenal woman, and you always are doing something. Like I don't know how you do it, but you're always doing something. There's something else that you told me about, like becoming a ACLS, BLS instructor, as opposed to, it's like Destiny comes up with knows so much. It is so young, and it's it's just really refreshing.
I don't like to limit myself. Like, so that's why I see like For example, like with my nursing license, I'm always like, how can I use my nursing license for something else? Because, you know, you don't want to always just be at the hospital. Sometimes the hospital does get draining, but I just love bedside.
Yeah.
But some people don't like bedside. So it's like, okay, what else can I do with my license? So it's like, you know, having a med spa. There's other businesses. You could own a nursing agency. You could own a
Is that for
rehab.
staffing?
Yeah,
Okay.
staffing. There's like a lot of stuff you could do with your nursing license. So it's like really good, like to just like not limit yourself. And like you said, the BLS instructor, we need to renew our BLS, our CPR certificate every 2 years. So, you know, everybody in the hospital is always running around like, I can't make it to the offered by the hospital, but if you have a like instructor license, you could just hop on Zoom with them and renew it for $60.
Yeah.
So like imagine how many $60 you could get in your own hospital.
I'm saying, stop playing with Destiny.
Okay, period.
NP to be by May.
Yes, and I'm already studying for my board. So what I did with my NCLEX, my registered nurse, I didn't start studying until like 2 weeks before.
Okay.
So
Now
I didn't want to
changing
do that
it.
this time. I felt like I was too lenient with my boards, and I didn't want to be like that with my NP.
Yeah, because you only want to take it once.
Exactly.
But like I said, I am so proud of you. I think you're super amazing.
Thank you.
Please follow the link below. I'm going to put your Instagram and your website so you can find Destiny, and we will see you next time. I think next time we're going to actually go to your spa.
Okay.
And film what you
Yes.
do. Maybe do some Botox and lip fillers to see
that'll
what a
be
day
fun.
with Destiny is like.
Yeah, that'll
Okay.
be fun. Some IV therapy. And then maybe like we could do a class that day. I'll
Yeah.
make sure, yeah.
So stay tuned. Money, Power, and Medicine. See you guys next time.
Thank you.